Hello, I'm John Urbans, President and CEO of Greater Fort Wayne, Inc. Thank you for joining us today for the Roadmap to a Healthy Reopening webinar series. Today, we'll be focusing on professional services and office. I want to thank our partners at Parkview Health, the Northeast Indiana Regional Partnership, and the Allen County Department of Health. Special thanks to Dr. Deborah McMahon and Mindy Waldron from the Department of Health for their great leadership during this pandemic. Also, Heather Schegler at Parkview, the staff here at GFW and at the Regional Partnership. A great deal of time and effort has gone into bringing you this series. We're very proud to be bringing this critical information to our business community. Just a few housekeeping items. We will be having a significant amount of time in the second half for Q&A. We will be using the question and answer tab at the bottom of your screen that you can submit your questions. Each participant will receive an email with a survey for the program immediately following, and then you will receive a second email with a copy of the recording and of the slides that were presented here today. I want to thank the participants for being here today, but for also submitting several questions ahead of time. Those questions served as a guide for the Parkview team to develop the content. While you may not hear your specific question asked, we hope that the information that is shared will address your most pressing concerns. I'd like to introduce the Parkview participants today. We have JoLynn Succo, Chief Innovation Officer, Dr. Jeffrey Board, Chief Safety and Quality Officer, Gina Jackway, Chief Community and Human Resources Officer, and Dr. Mike Knipp, Parkview Total Health Chief Medical Officer. JoLynn, I'll turn it over to you.
Great, thanks, John. So welcome to Businesses and Professional Services. I want to thank you for joining us today. As John said, I'm JoLynn Succo, and I have the privilege of serving as the Chief Innovation Officer for Parkview Health. I want to start this webinar by saying thank you for all that you have done for us as we have been there for you. Thank you for staying home to slow the spread of COVID-19. We've been really overwhelmed by the generosity of our community. We've received hundreds of cards for coworkers and patients, distributed thousands of meals donated by restaurants, and were moved by the flyover of the 122nd Fighter Wing and the socially distanced prayer vigil. We're really humbled by your generosity. I also want to share a little bit about how we're doing today. So as you can see on this slide, this is our COVID impact meter. We are cautious, but we're not in crisis. And the good news is we haven't been in crisis since we began 60 days ago. What we're seeing this week is that our hospitalized COVID positive patient cases have plateaued, and we're beginning to think about restarting elective surgeries on Monday. We're also starting to see in the last couple of weeks more patients coming to our emergency room. And that is really important because we're seeing patients who've delayed really needed care because of the fear of coming into the hospital. So we are hopeful. We, like you, are beginning to think about how we begin to safely open up the parts of our operations that we suspended due to COVID-19. And we're thinking really hard about how the world looks different today than it did 60 days ago. As we think about this, there are some really important considerations that are going to guide all of our planning and our actions. First, we are going to continue to have positive cases throughout the community. COVID-19 is here, and it's going to continue to be part of the community. We know that vaccines for COVID are at least 12 to 18 months away, and that's very optimistic. We expect it to be a little bit bumpy as we reopen Northeast Indiana. We expect some resurgence, and we really want to do all that we can to keep those surges low. We're also operating in a world where the information we have is evolving and dynamic. So we're implementing safe practices that will help our coworkers, customers, and community. And we know that crises like COVID challenge us to think differently, innovate, and emerge stronger. So today, I'm excited to share, especially for this session, that we've invited some really important subject matter experts in ergonomics and IS. And I'm going to turn it over to Dr. Jeff Ford to talk about keeping a workplace well.
Hello, everyone. When we think about place, we want you to think about your built environment and the spaces that your coworkers, customers, vendors, and clients engage in business in your location. So this is the physical building. This may be office space where you have only employee interactions. You may have areas where you meet with visitors, clients, and customers. You may have common areas, so think about things like break rooms, food service area, those types of things. Also, you may have additional common areas that you may share with another business, such as a common lobby space in a large office building. And you have to think about your plans with all of those various spaces. The recovery plan needs to consider the reality that we are in what we call community spread of COVID-19 in the United States. And this means that it's not limited to any one place or area, that all individuals in our region are potentially susceptible to infection and exposure to the virus, because there is no herd immunity, because it is a novel coronavirus. And we would not be able to pinpoint the source at which someone might acquire an infection. So we see a patient in a clinic, emergency department or hospital, and they're ill. We generally are not going to be able to pinpoint where that individual was exposed and acquired the infection. Although there is universal susceptibility to infection, the risk of severe illness from COVID-19 is different for different members of the population in our community. So we know from clinical experience with COVID-19 and published medical papers that older adults and adults that have chronic health conditions are more susceptible to becoming severely ill and requiring hospitalization or even potentially ICU level care if they become ill with COVID-19. A very important framework to keep in mind as you develop your reopening plan for your place of business is the hierarchy of controls, and this is a foundational occupational health and safety framework. The hierarchy of controls goes from most effective at the top to less effective as you go down. At the top, we have elimination, which is physically removing the employee from the hazard. Second is engineering controls, which you can think of as designing ways to isolate people from the hazard. Third is administration controls, which is changing the way people do their work. So workflows, processes, workplace behaviors to mitigate the risk of exposure. And finally, at the bottom, the last line of defense is personal protective equipment, or PPE. This is, as I said, the last line of defense, and that's something we should think about only after we've considered what other strategies on the other levels of the hierarchy we can apply before going to personal protective equipment. It's very important that if personal protective equipment is part of your safety plan, that you help your employees choose the right type of personal protective equipment, and that they are properly trained on selection and use, particularly putting on and removing that personal protective equipment. The CDC recommends that all businesses consider their engineering controls, that they support the administrative controls, such as making sure that employees, clients, and visitors are aware of things such as respiratory etiquette, that you have hand hygiene for employees, visitors, and clients, that you make things like hand sanitizer readily available, that you have ways to help people with social distancing within your workplace, and also developing processes for enhanced cleaning and disinfection. And the best way to guarantee robust cleaning and disinfection is really to engage all of your employees in that effort. So one of the things that we do in our incident command center at Parkview is when we start the day, we have cleaning supplies in the incident command center, and we each clean off our workspace and high touch areas at the beginning of the day. We do it again at the end of our shift so that we can maintain a high level of cleaning and disinfection in our workspace. This is a table of those workplace considerations using the hierarchy of controls. You can see on the right of the slide, this is a diagram that we got from the Toyota Safe at Work resource. And you can see that by reordering the workspace, separating desk workspaces, for example, you can help ensure appropriate social distancing in an office-based setting. I want to spend a few moments talking to you about testing. There's been a great deal of discussion about testing in the media with the COVID-19 pandemic. So I want to briefly talk with you about the two types of testing that are currently available and what their uses and, most importantly, limitations are when applying to the idea about reopening a workplace. First, I want to talk about antibody testing. This is a blood test, either a blood draw or a blood sample drawn from the tip of the finger. And this does have a very important and appropriate use for what we call population surveillance. So this is identifying how many people in a given population have had past infection. And right now, the Indiana State Department of Health, in partnership with the Indiana University School of Public Health, is doing a population surveillance study in every county in Indiana. They are sampling a large number of individuals in each county systematically, and they're going to repeat that sampling process several times over a 12-month period. And this will allow them to develop information about how the spread of COVID-19 has been occurring in our communities and regions across the state. This can help inform public health measures and can also help inform policy decisions on a community, regional, and statewide level. Antibody testing also does have a role in clinical research of COVID-19. There are important limitations for antibody testing, however. At this time, medical science, we do not know specifically with COVID-19 whether or not antibodies are in fact protective, meaning that if an individual does have detectable antibodies, we do not yet know for certain whether or not they would be immune to reinfection. We also do not know whether or not having antibodies means that you could or could not transmit the virus to others. So having a positive antibody titer is no guarantee of you not becoming ill with COVID-19, and it is no guarantee that you could not spread the illness to other vulnerable people. The other challenge is that in order to rapidly bring tests as quickly as possible to market, the Food and Drug Administration lifted or waived lots of typical regulatory requirements for diagnostic testing. They use what's called the emergency use authorization provision, and the majority of tests currently on the market have not even undergone the emergency use authorization provision and have had no scrutiny or evaluation by the FDA and have not had any formal large-scale validation by a clinical reference laboratory. This means that many tests on the market, unfortunately, are inaccurate or unreliable. With this in mind, it is totally inappropriate to use an antibody test to make return to work decisions or return to school decisions for any individual. PCR testing is a nasal or nasopharyngeal swab. This is what we use to diagnose active infection in people with symptoms. The swab actually detects RNA from the virus itself in the back of the throat. So collecting the sample, we use this test to determine if virus RNA is present, which means there's active infection. An important thing to keep in mind with this test is people that are asymptomatic or very early in the pre-symptomatic phase of the illness may not be shedding enough virus in the back of the throat for this swab test to detect. That means that you can have what is called a false negative. So someone who is asymptomatic or is not going to develop symptoms for a few more days, may have a negative result and still end up harboring the virus and could still be infectious. The other thing to keep in mind is that this swab test is a snapshot in time. So if the test is negative, it just tells us that you do not have detectable virus in the back of the throat at the time we collect the swab. Someone can have no symptoms and a negative test, and in a matter of days could be exposed and could easily become infectious. So a negative test does not mean that you could not become infectious or pass the virus on to others in the future. This is how we have used the hierarchy of controls at Parkview Health. We call this more than a mask. So helping people to think beyond just personal protective equipment and thinking about all of the opportunities to eliminate or greatly reduce the risk of infection in clinical and non-clinical areas. So some examples of elimination tactics would be having coworkers stay home if they are sick. Another elimination tactic that has been very successful for us is using virtual health. So using telephone or online video visits to help deliver care to patients in the community without requiring a face-to-face visit. Last week alone, we conducted over 6,000 virtual visits, and this eliminates the risk to patients and coworkers of infection of COVID-19 while still rendering community-based clinical care. Holding virtual meetings is another very good example in the office place of how you can eliminate the risk of infection. Next is engineering controls. We use this in the clinical setting. For example, having what are called negative airflow or negative pressure rooms to help isolate people that might have a respiratory infection in clinical areas. We also use things like plexiglass barriers and other types of engineering controls. Administrative controls are things like having regular attention to hand hygiene, social distancing, and other behaviors that can help minimize the risk of infection, such as routine workplace cleaning and also eliminating high-touch common use items in the workplace. Finally, we have personal protective equipment. In clinical care, we have to use this most often because there are not, the other controls are not going to be applicable when you have to provide direct in-person care, particularly in a hospital or procedural setting. So we rely on personal protective equipment, but I have to emphasize you must select the right kind of equipment and people must be properly trained on use of that equipment for maximum safety. With that, I'd like to turn things over to Dina Jackway, our Chief Community and HR Officer.
Thank you, Dr. Board. Good morning. It's great to be here with all of you. So we recognize the last 50 to 60 days have felt like one of our local CEOs put it. It feels like we're flying a plane and trying to fix it at the same time. We know that our world has changed, our community has changed, and as individuals, we're all impacted in a different way. From an organization perspective, people are the most valuable resource. And so when we think about the comments we're going to dive into today, think about, yes, your coworkers, those that you're working with, but also your vendors, your patrons, your customers coming in, and then broader, even broader, the community at large. I think it's important because as many changes that we have to make in the workplace, thinking of this broader group of people will help us be able to be social distanced appropriately and provide the right services. So the CDC put out several recommendations that we want to share that have worked really well, and also intertwining into the comments what has worked really well here at Parkview. So the first is identifying a workplace coordinator. We think it is imperative to have one person, a group of people. For Parkview, that's an entire incident command center. But for a smaller organization, you need to identify someone who's going to be that central source of truth. Your coworkers are receiving information from a variety of sources right now. So it could be Facebook, it could be social media, it could be national news. How do we bring information back to them that makes the most sense for what they're going to experience in their workplace? And for some, coming back into the workplace as we're recovering. That person that you're identifying may be in HR. If you don't have an HR department, it may be a broader group of individuals, but having that central source is, again, very important. Implementing flexible policies and procedures. And I think we cannot underscore this enough that right now we're needing to change the way we do things, which also means changing the way we're approaching our work, how we're doing our work, and where people are doing their work. And so I'll give you a really good example. We talk about the remote workforce. And for Parkview, for many years, it's been, we're not going to support our hourly coworkers working from home. Well, we have about 4,500 of our 13,000 right now working from home. And we did that very fast. And so that's something that we looked at and said we had to flex, we had to be nimble. And so we're challenging organizations to think of new ways in terms of how you can do your work, that it doesn't need to be all within the workspace, again, to accommodate social distancing. Educating coworkers is really important, and we really want to stress when you're educating to the coworkers what they're going to be experiencing in the workplace. You also need to talk about the why, because you're asking individuals to do things perhaps differently than they've ever done before. And so without explaining the why, they don't always understand how that impacts them. And we know fears are running high. We know that people have a lot of questions. So being able to, again, put information out that helps calm those fears, help people understand how they're going to experience life at work during this recovery. And then also considering social distancing. We know that work is going to be different because we're going to have to do it physically apart, but you also want to consider the vulnerable. And you may have coworkers that say, I can't do these things because of having underlying health conditions, and they're going to be more vulnerable in some of their exposures. Make sure that as an organization, you have a process to be able to evaluate and potentially accommodate those restrictions. But you also might need to do that for your patrons. Depending on your business, you may need to identify perhaps a certain time of day or a certain way that those that are vulnerable are receiving your services and products. On the staffing side, building flexibility, we know that right now with so many people that have children working, they're working, but they're also having children who are at home right now because of digital learning, or perhaps childcare is not being open. We know that we as an organization need to be flexible, as well as those coworkers being flexible, because we're asking them to do work perhaps different than what they've done before. I'll give you a good example. Our athletic trainers right now, they're not in the schools. They're not working with students and helping them be at their tip-top shape. Well, we've now redeployed them to other areas. Some are in nursing units. Some are working in office settings in other roles. But asking individuals, yes, to do things a little differently is certainly appropriate during these times. At the same time, we as an organization have to be flexible because of childcare barriers. We have to make sure that people may have to work different hours than they've worked before. And how can we be flexible to adjust those schedules? As you think about new normal, and I know that phrase is used a lot, but there's so many things that we're all changing around in our businesses today that we might very well want to keep on the other side of this. Things that are working well, the virtual visits, as Dr. Board mentioned, in some of your businesses, really being able to interact with customers differently or more virtually might be something that you want to continue and not take away. I'm going to talk a little bit about our return to work process. And I'm not going to spend a lot of time talking about the specifics of Parkview, just because as a large employer, we have a very centralized process. But as your ill coworkers are coming back into the workplace, you need to make sure you have an appropriate return to work process, so that not only are you keeping those coworkers safe as they're coming back in, but you're keeping all the rest of your coworkers safe as well. We know this is absolutely a concern. People, if they know someone's been sick, they want to know, how is my employer taking care of that to ensure that they're not going to spread that to me, or they're not going to spread that to others, and certainly to your customers. So having a return to work process for those coming back in who are ill will be a critical part of your return. And then, as I mentioned earlier, the remote workers. So right now with 4,500 individuals, the question has come up from our remote coworkers saying, well, when the governor announces today what he's going to do with the stay-at-home order, we're all coming back to work on Monday, right? And we've said, absolutely not. Regardless of what the governor says, we, for our 4,500 working from home, want you to remain at home. And so what we've done, and you can see the model that we have here, I'm not going to go through it in great detail, but part of what we want to do is phase individuals back in and over time. But we want to make sure there's no time frame on this. It could take us 12 to 18 months to get everyone back. It may take even longer. It really all depends on clinically from what the cases look like in our region, what is happening within our organization to better determine who needs to come back and when. So we're encouraging you as organizations, don't bring everyone back all at once. Think about who needs to come back, what work needs to be done if you're going to prioritize that. On this next slide here, we've identified just a few things to consider when who to maybe bring back first. And again, we want to take phases. For us, it was 25%. For you, it may be a different percentage. But we have some right now who are chomping at the bit. They're at home. They want to come back to work. And so those may be prioritized as someone who comes back first if they're roles that we deem appropriate. Those that have childcare, we may, again, prioritize to bring back rather than those that are going to struggle with providing that afterwards. So you can see some of the other guidelines that we have. I think the main point here is making sure you have a plan and you do not need to bring everyone back all together, particularly if you're not able to keep the social distance guidelines at play. So for us, we know that we have some coworkers, and maybe you as well, that want to stay working from home. They want to continue to be remote, and we can help support that. But a few things to consider. When we send everyone home and so quickly, we know that offices may not be in everyone's home. We know that they might be sitting on the couch. We know they might be at the kitchen table, wherever they're setting up. And ergonomically, that's not necessarily appropriate long term. Does everyone have the right tools and equipment that they need to do their job? So you can see here, we're just listing a few things to make sure if you've got individuals who are going to remain at home, thinking about the equipment, the technology, the security that we need, making sure they have appropriate internet. What are the processes and guidelines that are going to be around those working from home? And really, how are you going to judge the work that they're doing? We've had so many employers ask, well, how do you know if they're actually working? And so that's really going to be up to each individual leader, but identifying what are the key outcomes that you're expecting to see from that coworker, no different than if they were physically in the office. We all know that time in the office does not equate to productivity and what the outcomes are being achieved. So again, we would just identify what that means working from home. Shifting a little bit to what Parkview is doing, and I'm not going to cover all of these just for time. We want to get to Q&A, but we also want to make sure you might take away some things from some of what we've learned and what we've put into place. The first of which is just simply asking your coworkers what they need. It sounds really simple, but for us, it was so powerful. Simply asking, what are your barriers? What are the things that you need? What's on your mind? What are some of the fears that you have? And us being able to then help address that and bring them some of the resources that were needed. It was very powerful for us, and again, so simple just to ask. It also gives you an idea of what's on their mind. We flexed a lot of our benefits. We flexed our PTO benefits, allowing people to go into the negative if they didn't have enough. We made sure that our leave of absence policies were broadened up beyond the coworkers, so that they had family members who were sick, that they could be able to be off and take care of them. Our attendance policies were flexed. So we really tried to step back and think about how can we be more flexible during this time. And then also mental health. We know that every individual is different and they're all experiencing things different. You cannot put a one-size-fits-all process out there. And so we came up with a variety of ways to help our coworkers. And we used the Calm app as one of those ways and gave everyone a subscription to the Calm app and made sure that they were able to use it for anxiety, breathing techniques, helping sleep, whatever that looked like. But not only did our coworkers use it, it was great to hear that their family members used it as well. So it's something very simple. It's just an app on Google and Android, but it's, again, something that helps everyone a little bit differently. We used our EAP program in new and exciting ways that were more virtual to, again, reach out to our coworkers and helping them through what they needed. I'm now going to turn it over to Dr. Nip. Thanks.
Thank you, Dina. All right, hi, Dr. Mike Nip from Occupational Medicine here, just with a couple of industry-specific insights for you real quick. Here's a slide, again, on the right, you're seeing the hierarchy of controls with some examples. I did want to focus more for my time here on the left side and the orange. A couple things to call out. The first one is, wherever you end up finding your solution regarding your office space or your workspace, you want to try as much as you can to make the optimally safe and healthy choice easy and automatic for your employees and patrons who may be coming into your workplace. The second thing I wanted to talk about is innovation is probably already within your own organization. Finding the solution, the person who unravels that Gordian knot for you, it may be their first day on the job, but they have that idea that solves it for you. The other thing I wanted to call out here is to be very, very open and transparent, both what I'd call internally facing to your employees with what solutions and what extra steps you're taking to optimize their health and safety, but also for your customers and patrons. Is this letting them know on when they call in, hey, this is what you can expect when you come in. You're all the experts on creating the experience for your workspace and your company. But just an extra level is very helpful and tries to get at the some of the fears and concerns that we're all going to be sharing as we come back out into the workspace. So this slide here comes from Toyota, and their manual. They've done a really great job. I wanted to just call it a couple things. As you can see, there are lots of spaces you're thinking of in your office already. There's probably some that you maybe have not. And the real reality of it is you're going to have to think of solutions for each one of these. One of my near and dear things, the coffee maker. You may need to figure out a new way to get a steady supply of coffee for your office. You can see over there on the vending machine part, Toyota kind of goes with this plan of, if possibly you may need to eliminate something, but if you can't, what's the next best, most effective thing you can do? A couple other places to think of. I wanted to just call out real quickly the restroom as just an example of a simple strategy. Perhaps it's just even moving your waste receptacle closer to the door so that person who has their paper towel, they just washed their hands, they can go ahead and use that paper towel to contact the high-touch door handle instead of having to do that with their hand. And then the trash can's right there. They can go ahead and throw that away with avoiding having to touch that high-touch space. So this slide right here, so Jolynn, when she returns in a second, is going to talk a little bit more about our website. But when you go and you land there and you find your specific industry, you're going to see what we're kind of calling the best of the best that we've been able to find to help you start, keep moving, or hopefully finish finding a solution for your specific work area regarding whatever space or issue you are working with. Having said that, I'm going to turn it back to Jolynn.
Great, thanks, Dr. Nip. So we're really excited because we're here to help. At Parkview, we want to really help leaders lead through this pandemic. And I'm really excited to announce a new service, Parkview Business Connect. As we continue to operate in this pandemic, we are going to be offering a free resource to you. What you may think of us as healthcare, we're the largest employer in the region. We operate 10 cafes, a police force. We have an extensive grounds crew, office areas, frontline areas. So we're really learning every day in all that we do. And the dynamics of this pandemic are changing rapidly, which means that our responses may be changing as well. We've launched a Parkview Business Connect website where we're putting out lots of resources industry-specific resources, general resources, sharing our creative best practices, and we are sourcing these from all over really our region and and the country. I want to point out the green button there. You can click and email us. We will get back to you within 1 business day. And here is our connection point, 260 Connect. This is going to be up as we move into the Q&A, so it's readily available. So with that, I think we'll break to Q&A.
Jolynn, thank you to you and the Parkview team for walking through all that great information for everybody. We're going to be going through the Q&A. We've got a number of questions already queued up on the slides here, but we also have the tab down at the bottom that you can submit a question. And just to remind you that parkview.com/connect is a great way to get your questions answered as well. In case we don't get through all the questions here today, you'll be able to use that and get an answer direct from the Parkview team. First question, what is the responsibility of our business versus our landlord for cleaning, building changes for social distancing, et cetera?
This is Dr. Knipp. I'll take a stab at this one. I think the first thing I'd ask folks to do, as you can see there, is review any contract you have with the agent from which you lease your building. May seeking any legal advice for your counsel that you have. Of course, if they have a cleaning service they provide, there hopefully is a level of trust that their cleaning service is coming through and doing the proper cleaning according to CDC recommendations. But we do know, rubber hitting the road as it is, if you're doing the cleaning yourself according to CDC guidelines, calling back to Dr. Board, having everyone come in and clean their own workstation, that's a way to get closer to guaranteeing it was cleaned appropriately and properly each time.
How about on the visitor access to our buildings? Should we restrict visitor access? If so, how should we do this?
This is something that each office or business needs to look at their particular situation. So there are going to be some offices or businesses where they can pretty much conduct normal operations with few or no visitors. And if it is feasible to minimize or eliminate visitors, then that's the preferred approach to reduce risk of infection. However, there are many businesses where meeting with customers or clients is essential. So the key there is to take appropriate precautions. So this could be things, for example, as opposed to having people just walk in, having a process where they can have an appointment so that you don't have a bunch of people in a waiting room. If you have a waiting room, removing chairs and removing common touch items such as magazines, those types of things to make sure that you have a safe area. When you're meeting with clients, make sure that you're meeting in a space that can allow appropriate distancing. Make sure that you have hand hygiene, hand sanitizer available for employees, clients, and visitors, and also provide direction and signage to your visitors and clients and customers. Make sure you inform them what they can do to maintain a safe environment and a safe interaction. So people are generally going to want to do the right thing, and if you have clarity, and particularly if they have an appointment and you can coach them on the appropriate precautions ahead of time, you can help manage this. And then also just look at what are the sources of foot traffic in your building and what are unnecessary foot traffic things that you can mitigate or avoid.
There's obviously a lot of questions out there about masks. One of the big questions is, should I require all my employees to wear a mask? And if so, what kind? Should I require people that are coming into my business to wear a mask?
As we talked about earlier, it's very important to think about the entire hierarchy of controls and, as we say, more than a mask. So make sure that before you make a decision on masking that you've walked through and considered what are your elimination strategies, what are your engineering controls, and what are your administrative controls. Once you've done that, there may be circumstances and situations where masking may be an appropriate component of your overall safety plan. Remember that a cloth mask on an employee or on a visitor or customer is really for what we call source control, meaning that if I am wearing a cloth mask or face covering, it is to capture my cough or sneeze, to protect my cough or, keep my cough or sneeze off of everybody else. It's not personal protective equipment for me as an individual wearing the cloth face covering. So if you're going to be doing cloth face coverings and masks, then generally speaking, kind of everybody needs to be wearing them for them to be effective for what we call source control. So if you have a situation where, in the healthcare setting, for example, we really have to go to personal protective equipment if we are taking care of patients that might have infections or are high-risk individuals, and that's a little bit different circumstance. So it's important when you think about masking is selecting the right kind of PPE for the job. Also, you have to follow your state, local, and industry regulations. So if you have a business person and you're an employee that is using a chemical or is going to be dealing with fumes, they need to wear the appropriate type of respirator for that particular type of hazard. And those guidelines don't change. So when you think about a masking policy, though, there's some different considerations. So one thing is, if you are going to recommend that your employees all wear a cloth face covering, you have to decide, is that something that you want to provide as a business? Do your employees wear uniforms? If so, do you want to provide a mask that might coordinate well with the uniform? If you have visitors and clients, are you going to ask them to mask, and how are you going to communicate that to them to make your masking effective? And do people understand what a cloth face covering or mask is and how to wear it appropriately, making sure that it's cleaned on a regular basis? So just some considerations there.
Thanks for that. I know one of the things that we've gotten a lot of questions on is the sourcing of masks and cleaners. If participants go to our COVID resource page, covid19.gfw.inc.com, we're keeping a list there of local companies that are sourcing masks, and also some national contacts for people to try to secure masks. Also on some of the hand sanitizer and other supplies like that. So there is that resource out there. We're keeping a link on our resource hub that you can go to and check that kind of information. One of the things that we need to keep talking about is safely socially distancing, and how do we do that in an office environment?
Hi, it's Dr. Nip again. So I think the general principles are, you try as best you can to stay at this 6-foot distance. There are going to be many situations, industries, relationships in an office or any other setting where it's just not engineered in to be able to maintain that. For example, if you're doing a consultation in a smaller office, it's say, again, back to hierarchy, what's the next best thing you can do? So again, if you're in, for example, I've seen some questions on we're in a small office, a couple people, or if we need to have a confidential discussion, let's say you're in a legal office or a financial, then you would just hope to ensure that everyone has a mask. So you have source control on everyone in there. You're practicing hand hygiene. In those situations, it's kind of a forced innovation point for everyone to really fresh eyes look at their workspace and in as much as kind of redesign it according to a lot of these social distancing policies. And there at the bottom of the slide regarding people, again, back to some things that have already been said. Can you limit how many people are there at one time? Can you have go to more appointment only for certain things? Or any other strategies you could come up with?
Obviously, one key area everybody's got to enter, so waiting rooms are a key piece. The question, we currently have a waiting room where visitors sit before appointments. How can we encourage visitors to use social distancing or other safety measures there?
So think about the physical space. You need, when you look at your waiting room area, you sort of have to look at it with different eyes. So look at the chair setup, look at the seating arrangement. So is the seating arrangement conducive to people being 6 feet apart? So you may actually need to remove chairs and also look at removing any common high-touch items. So the magazines, brochures is a very common example, but also think about, you know, do you have a coffee pot or self-serve coffee or tea or water that's sitting in your waiting area that might be common touch surfaces that you might need to consider modifying and going to single-serve, single-use items as a substitute. Make hand sanitizer available. The other thing is controlling the foot traffic, right? So you can have fewer chairs and more space, but if you have tons of people crowded in your waiting room, you're not going to be able to maintain that social distancing. So how can you manage your foot traffic and your flow, going to an appointment type of setup and reducing, you know, large volumes of people in that waiting area at one given point in time can help maintain safety.
You already touched a little bit on meeting in small spaces, but how can we meet with our customers or clients in face-to-face meetings in small spaces, like financial advising, therapy, one-on-one situations?
Wherever possible, maintaining that social distance. So you may want to, instead of using a small office, you may want to use a conference room where you have your client can sit at least 6 to 8 feet away, but still be able to have that one-on-one conversation. Think about also, if you're using a larger room to meet with a client, if there are papers or decision aids that, you know, written materials you want to have your client review, have those set out ahead of time so that you're not passing those materials back and forth, or maybe use a digital solution where you can project information and graphics on a screen as opposed to handing people paper or brochures that you maybe pass back and forth. If you really don't have a space that's conducive to that kind of social distancing, you may want to consider having both the client and the employee masked for that interaction with a cloth face covering or mask.
This is a great question. How do I make sure my employees are virus-free when they come to work? Should I be doing temperature checks at the start of every shift?
Great question. I keep hoping that someone will invent the Star Trek tricorder that will allow me to scan everybody to make sure that they are virus-free, but we don't have that yet. And really, there is not any foolproof solution. So one of the most effective things you can do is make sure that customers and employees that are sick don't come in. So asking employees to make sure that they call in if they are ill and make sure they do not come to the workplace if they are sick. That's probably the single most important elimination strategy on the hierarchy of controls that you can employ. Make sure that your employees have clear guidance on when and how to call in sick, and that you facilitate that with your policies and procedures so that they can stay home from work if they are ill. I want to talk a little bit about temperature checks. So on the surface, this seems very simple and easy, but it's actually much more complex and less reliable than you might think. So medical studies have shown, for example, some of the early studies out of countries that were first afflicted with COVID-19, and we've certainly seen instances of this at Parkview Health, people coming in that we diagnose with COVID-19 that do not have a fever when they present. This can happen over 50% of the time. Often the patients will develop a fever further in the course of their illness, but the time they start having symptoms and are diagnosed, they may not necessarily have a fever. So a lack of a fever does not mean you are not sick. So if you have somebody who has no fever, but they have a cough, they have shortness of breath, they have chills, they may still be sick and could transmit the virus to others. So temperature screening in and of itself is going to miss a lot of people who might be ill. Second, if you're going to do temperature screening, you're generally going to have to get within 6 feet of people to do a temperature check. And that means that that individual doing the temperature check on behalf of your business is going to have to wear personal protective equipment. if you're going to use a touchless method like an IR temperature scanner, those have a 2-degree error rate. So there's plus minus 2 degrees on the measurement, which means that you are going to miss people with a low-grade fever using that type of device. So there's a lot of challenges with doing temperature screening just from a practical standpoint, and it has very important limitations regarding many patients with COVID-19 may not have a fever when they walk through the door.
Hi, it's Dr. Nib. Thanks, Dr. Board. I just wanted to add a couple medical legal aspects as well. So we know the EEOC, as of about a month or so ago, said in the setting of the pandemic, employers could perform this medical examination. I'm calling it the tiny pebble, many ripples effect, because so this, as a medical examination, this is a piece of protected health information that if it's going to be used to make a work decision, meaning you can't come in and you're sent home, that has to be recorded and protected just like any other piece of protected health information. Is this virtually on a computer spreadsheet, or is it, I guess I'd call it analog on a piece of paper that's under lock and key? And do you have a written policy that is before your temperature screening starts to detail how that is arranged? The policy would have to be every person every day, regardless if it's the owner or CEO or it's someone's whose first day on the job, to make that decision based on their reading. So I think, unfortunately, it has that. I think, too, Dr. Board touched on this, that if you want to be able to set up a partnership with employer-employee, so you're trying to avoid the situation where people may try to beat the screen, meaning do they take a fever-reducing medicine a couple, half hour, an hour before they would come to work? If you're doing an oral thermometer, are they slamming their big gulp a couple minutes before to get their oral temperature a little bit cooler? So I think, again, the simpler solution is have folks who are ill not come to work, create some flexibility so they don't have to make that choice.
We're coming into the summertime. Let's say one of my employees went on vacation. Do I allow them to return to work, ask them to quarantine? Does it matter where they went?
So just real briefly on this, I think we want to follow the State Department and the CDC guidelines. They've kept the international travel at a level 4. I'm advising employers that you need to follow the State Department if they've come back, and that's a 14-day quarantine. Local places, it gets a lot tougher. We've had to face the question with some coworkers for some employers that have been to New York City. As we know, that might still be considered the world epicenter. So it's a little bit of a tough question to answer, but at least at the outset, if it's an international travel, you would need to follow the State Department's institute continuing to self-monitor, and then whatever your company policy is on illness.
Let's say I have one of my employees who tested positive for COVID-19. Should I test everyone they work with?
It's a very good question. So the short answer is no, and there's a number of reasons for that. So as I mentioned earlier, the COVID-19 PCR nasopharyngeal swab its sensitivity is reduced in people that don't have any symptoms. So if someone has no symptoms, the test has got a significant probability of having what we call a false negative result, even if they do have the virus. So routine testing of a large number of people that are asymptomatic is going to give you a very false sense of reassurance. So really what's much more practical is if workers are asymptomatic, and we've dealt with this many times in the clinical setting because we are a healthcare organization that takes care of sick people that have COVID-19, is we have people self-monitor, and then if they do develop symptoms, then we will arrange for testing, have them stay home from work. And if they're asymptomatic, self-monitor. You can also, again, if you have a masking program, that also helps with source control, and those individuals can remain at work while following those other safety parameters, social distancing, hand hygiene, etc.
We've heard a lot about the 6 feet of separation. Is that the right distance that we should maintain, or should we try to achieve a longer distance, especially if proximity is maintained for extended periods?
Well, the 6-foot rule it's you know, it's a somewhat arbitrary number, but it's based upon kind of studies around, largely COVID-19 is transmitted through what we call droplet, right? So this is coughs and sneezes, et cetera. And generally the 6 feet, when this has been studied, has been kind of the perimeter where the risk of that tends to be the greatest. And it's generally going to be prolonged close contact. So, if I'm closer than 6 feet from you for 3 seconds, my risk is pretty negligible. But if I'm in that 6-foot circle for 5, 10, 20 minutes, that's really where the risk might go up. So 6 feet is kind of if your office space and your physical work configuration can support an 8 or 10 foot distance, more is generally better. It really, you just have to look at that workspace, and that 6-foot guidance just comes from droplet precautions.
Hi, it's Dr. Nip. I'm seeing a question about elevators. So I think at the outset, what is challenging is, as employers, you can only control what you can control. Obviously, if you're it's not your building or other businesses share it with you, you can only do so much for that. But I think, again, some principles like Dr. Board was saying, try to maintain the 6 foot if you can. Can you work with whoever owns your building to say, can we just put some markers down in an elevator to prime the environment for the people to stand apart? Can you put hand sanitizer, make it available near where the buttons would be, or any other way to clean hands, things like that? Could they post signage to say, please, if you see more than 3 people in the elevator, can you wait for the next one, stuff like that? Or just to put a shout out for healthy lifestyle, take the stairs if you can, because that's still a thing, right, Dr. Board? Stairs are a thing? Okay.
Yes.
Stairs are a thing.
If you can take the stairs, remember, that's eliminating eliminating of the risk of being in the elevator.
And you go at your Fitbit for the day, so.
Can we maybe you talked about masks a lot, and there's been a lot of talk about wearing them properly. Is there a good resource for how to don and doff a mask properly? And that probably goes to gloves too.
Hi, this is Jolynn. We're going to continue to update our website with donning and doffing a mask, probably with some videos and examples. I'm going to turn it over to Dr. Nip and Dr. Board to talk about the importance of properly donning and doffing, and maybe talk a little about cloth masks in this situation.
I'll speak just real quick. I think that from N95 down, what we've had to communicate to our healthcare workers is just like if you're a size 10 shoe, you still have to put the shoe on correctly each time. So an improperly donned and used N95 is not going to be very effective. I will say God love them, at the grocery store, I've seen some people with a wide variety of techniques for wearing masks. And I've stopped from going up and correcting them. My wife is appreciative of that, but I think there's resources. There's a very good CDC one sheet that talks about N95s, but also I think what Jolynn said, we're hoping to get up soon very much on because most people are going to be doing kind of the surgical mask, which might be just the hook behind the ear to tying behind on the head. And I think we'd be able to, if we have requests, or just maybe look on our site in the next couple of days, but if there's a specific question, please let us know about that. Dr. Board, anything?
Yeah, for cloth masks in particular, I think one of the big keys is a snug fit. So if you have a surgical mask with the tie on, or an ear loop mask, if it's very loose and you can see lots of daylight between the side of the mask and the side of your face, it's really not going to be effective. It needs to be close fitting in order to contain coughs and sneezes. So, if you have big gaps at the side or underneath the chin, all that's going to happen is that respiratory is just going to be jettisoned out the side of the bottom instead of straight ahead. But So it's having that close-fitting cloth mask is going to be most effective.
We've had some questions on ventilation. How do you engineer proper ventilation in a small space? Any considerations on air purifiers?
This is Anna Bullock, and I'm the Director of Safety for Parkview Health. So some of the things that we've used in some of our business occupancy spaces are the HEPA filters. So when we look at purifying the air in that space, if you don't have the means to increase your air exchanges in that space, then I definitely would recommend a HEPA filter, some type of a purifying, maybe a floor mounted device. And there's different ones out there, so just make sure you're looking at the space, the size of the space that you're going to be placing the device in, and the number of individuals in that space when you're looking at those.
This question is probably more directed to somebody at the Department of Health, but if you could maybe touch on, there's been some media about testing facility now opened up in Allen County. There's been a lot of talk about tracing out there in the media. Could you touch on that just a little bit?
Oh, this is Dr. McMahon. Excuse me, I don't have COVID. We did partner with Kroger, and there is a site in the Dwenger High School parking lot that free testing is being offered by Kroger. This is the PCR nasal swab. And again, it has all the limitations that Dr. Board has very nicely pointed out. The only time that you should really get this type of testing is if you are currently symptomatic. They are looking at partnering with Fairbanks School of Medicine to do some serology testing. That's the antibody testing that Dr. Board talked about. And that is to try and understand the prevalence of COVID infection in our community. That is by, shall we say, invitation only. So there is no widespread antibody testing yet, and I really appreciate the job that Dr. Board did in really explaining the limitations of that type of testing. But you can get the COVID PCR testing for symptomatic folks through hospitals, through your doctor's offices, and now through this drive-through Kroger clinic at Dwenger.
Well, I want to thank all of our presenters today. I want to thank all the participants for joining us today. I just want to remind you, parkview.com/businessconnect is available for you to submit questions if they were not answered, or if you have additional questions. I want to thank our partners, Parkview Health, the Department of Health, the Northeast Indiana Regional Partnership, and obviously Greater Fort Wayne, Inc. Thank you all for helping bring this to us today. We're here to help you. If there's any questions you have, please feel free to reach out to us or directly to any of the partners on this webinar. I want to thank you and have a good day.